There are many different kinds of heart disease, and while each can produce its own set of symptoms, there are some key ones that many types share. These frequent symptoms include chest pain or discomfort, palpitations, lightheadedness or dizziness, fainting, fatigue, and shortness of breath. However, sometimes heart disease has no symptoms at all. Chest pain or discomfort. Few symptoms are more alarming than chest pain, and while many other conditions can cause chest pain, cardiac disease is so common and so dangerous that this symptom should never be dismissed or considered insignificant. Chest pain is an imprecise term. It's often used to describe any pain, pressure, squeezing, choking, numbness, or other discomforts in the chest, neck, or upper abdomen, and it's often also associated with pain in the jaw, head, or arms. Depending on its cause, chest pain may last from less than a second to days or weeks, might occur frequently or rarely, and might occur completely randomly or under predictable circumstances. Sorting through these variations can help your doctor determine the actual cause of your chest discomfort, in particular, whether it represents angina or some other serious problem. Palpitations. Noticeable differences in your heartbeat, whether that means it's rapid, unusually strong, or irregular, are classified as palpitations. They are an extremely common symptom of heart disease. Many people who complain of palpitations describe them either as skips in the heartbeat, that is, a pause, often followed by a particularly strong beat, or as periods of rapid and/or irregular heartbeats. Most people with palpitations have some type of cardiac arrhythmia, an abnormal heart rhythm. There are many types of arrhythmias, and almost all can cause palpitations. The most common causes of palpitations are premature atrial complexes, PACS, premature ventricular complexes, PVCS, episodes of atrial fibrillation, and episodes of supraventricular tachycardia, SVT. Unfortunately, on occasion, palpitations can signal a more dangerous heart arrhythmia, such as ventricular tachycardia. 3 palpitations are more likely to signal a serious cause if they're accompanied by episodes of lightheadedness or dizziness. Lightheadedness or dizziness. Episodes of lightheadedness or dizziness can have many causes including anemia, low blood count, and other blood disorders, dehydration, viral illnesses, prolonged bed rest, diabetes, thyroid disease, gastrointestinal disturbances, liver disease, kidney disease, vascular disease, neurological disorders, dysautonomias, esophageal episodes, heart failure, and cardiac arrhythmias. Because so many different conditions can produce these symptoms, if you experience episodes of lightheadedness or dizziness, you ought to have a thorough and complete examination by your physician. Fatigue, lethargy, or daytime sleepiness. Fatigue, lethargy, and somnolence, daytime sleepiness, are very common symptoms. Fatigue or lethargy can be thought of as tiredness, exhaustion, or loss of enthusiasm that makes it difficult to function at your normal level. Somnolence implies that you either crave sleep or, worse, that you find yourself suddenly asleep during the daytime, a condition known as narcolepsy. While fatigue and lethargy can be symptoms of heart disease, particularly heart failure, these common and non-specific symptoms can also be due to disorders of virtually any other organ system in the body. If you suffer from fatigue or lethargy, you need a general medical evaluation in order to begin pinning down a specific cause. Somnolence is often caused by nocturnal sleep disorders such as sleep apnea, restless leg syndrome, or insomnia. Dyspnea, shortness of breath. Dyspnea, the medical term for shortness of breath, is most often a symptom of cardiac or pulmonary, lung, disorders. Heart failure and coronary artery disease frequently produce shortness of breath among other symptoms. If you have heart failure, you may commonly experience dyspnea with exertion, or orthopnea, which is dyspnea when lying flat. You may also suddenly wake up at night gasping for breath, a condition known as paroxysmal nocturnal dyspnea. Other cardiac conditions such as heart valve disease or pericardial disease can produce dyspnea, as can cardiac arrhythmias. Syncup, fainting, loss of consciousness. Syncup is a sudden and temporary loss of consciousness or fainting. It's a common symptom, most people pass out at least once in their lives, and often does not indicate a serious medical problem. However, sometimes syncup indicates a dangerous or even life-threatening condition, so it's important to figure out the cause. The causes of syncup can be grouped into 4 major categories: neurologic, metabolic, vasomotor, and cardiac. Of these, only cardiac syncup carries a serious threat of causing sudden death. Vasomotor syncup, commonly called esophageal syncup, is by far the most common cause. It happens when your body reacts to certain triggers such as severe emotional stress or seeing blood or needles. Neurologic and metabolic syncup are relatively rare. When to see a doctor. The symptoms most commonly caused by heart disease can also be produced by other medical conditions, from very serious to entirely benign. If you experience any of the above symptoms, you need an evaluation by your doctor to identify the cause. These are symptoms that should never be ignored. Additionally, if you're having any difficulty getting an erection, especially if the problem has been gradual, this is nearly always one of the first signs of either heart disease or diabetes in men. Be sure to see your doctor as soon as you notice any problem with erectile dysfunction. If you have a family history of heart disease or you're worried about your risk for developing it, be sure to talk to your doctor. Staying proactive where your heart health is concerned can help you detect any problems early, giving you a better potential outcome.